Okay, I'm checking my doctor's orders, gathering my material.
Come in.
Okay. I'm going to provide for privacy. Hi, my name is Sandy. I'm going to be doing a head-to-toe assessment, okay? So wash my hands. Can you tell me your name and date of birth?
Laura Dillon, 9/23/96.
Okay, checking that with my chart and it matched. Are you allergic to anything?
No.
Okay. Are you in any pain?
No.
Do you need to go to the bathroom?
No.
Okay. I have reviewed her health history and I would take her vitals, being her temperature, pulse, blood pressure, respirations, O2, her pain scale, height and weight. And then I would continue doing my assessment. My general appearance of her is that she's breathing and she's alert and oriented. I don't know by how much, but she is alert and oriented. Her skin looks good from what I can see. She's making eye contact and I can't smell anything, so she's clean. Okay, I'm gonna have you sit up for me, okay? And I'm just going to ask you a couple of questions, okay? Can you tell me where you're at?
I am at Rachel's house.
Okay, can you tell me why you're here?
To get assessed.
And can you tell me what day it is?
Tuesday.
March 2nd.
Okay, so she's alert and oriented times 4. Can you squeeze my fingers?
Yes.
Okay. Can you push down? Pull up? Okay. Her grip is equal and bilateral. Her strength is good. And I'm going to inspect your hair, okay? And while I'm inspecting your head and stuff, I'm going to be inspecting for the olfactory nerve, the optic nerve, the ocular motor, the trochlear, the trigeminal abducens, the facial nerve, acoustic, hypoglossal, vagus, accessory, and hypoglossopharyngeal, okay? My general appearance of it before even touching her hair is it looks fine, it looks shiny, looks healthy. No smell like I said earlier, so I'm pretty sure she washed her hair. I'm going to put my gloves on. I don't have any, so I'm going to simulate like I did. I don't feel any bumps, lesions, abrasions. I don't see any bruising. Her scalp looks fine. I don't see any bugs crawling in or out, so it looks good. And now I'm going to inspect your eyes, okay? I'm just going to, my general appearance of it, they're hazily brown, greenish, I don't know what color to describe it as, and they're symmetrical. Her pupils look good. Okay, I'm going to have you look into my eye, okay? I'm not, to my pen light. Can you look into the shoulder? Okay, can you look at this shoulder? Okay, looks good. I'm going to pull down, can you look up? Conjunctiva looks good, the mucosa looks good too. Sorry. Well, do you wear glasses or contacts?
Glasses.
Okay, and when was your last eye exam?
December.
Okay, I'm going to have you follow my finger, okay? Okay, and tell me when you see my fingers.
No.
Okay, and now I'm going to take out my ophthalmoscope and look for her fundus, okay? Looks good, orangey. Okay, and I would say her pupil millimeter is about a 4 to a 5. Okay, and I'm gonna ask you a couple of questions about your hearing, okay?
Okay.
Do you feel any ear pain?
Mm-mm.
Okay, just checking her auricles, and it looks fine. I'm gonna look into your ear, okay?
Okay.
Tell me if it hurts at any point. This would be an otoscope. I don't have one, so I'm gonna simulate. Okay. Looks a little bit of earwax, which is normal. I see some hair, and it's like a gray membrane. Looking at her tympanic membrane. Same on this side, looks good. Okay, I'm gonna do a whisper test, okay? Let me know what you hear.
Summer.
Okay.
Winter.
Okay, good. I'm gonna be looking up your nose, okay? Her nose looks symmetrical as well as her ears. Her ears did look symmetrical. And I'm going to look up to see if there's any septum deviation. Nope, looks good. Have you had like a cough, anything lately? Do you have any like mucus coming out or sputum? No? Okay. I'm going to inspect her sinuses. I don't feel anything bad, so that's good. Do you have any pain in your sinuses at all? Okay. I'm going to inspect your mouth, okay? Her lips don't look cracked, and they look pink, which is good. Can you open up your mouth? Okay. It looks moist in there. And her mucosa's pink, which is also good. Her uvula was midline, and her tonsils, she doesn't have any. I'm going to do a gag reflex, okay? I'm not going to go too far back. Okay. She's a little scared, so I'm not gonna do this, but I would assess her gag reflex. And now I'm gonna assess your neck, okay? Feeling for her thyroids, and I don't feel any, which is good. Can you swallow? Swallowing is good. And can you tell me how often you brush your teeth?
Twice a day.
How often do you floss?
Once a day.
And what was your last dental exam?
December.
Okay. I'll have you lay back down, okay? I'm just going to assess her skin. I'm just going to take this off to look at your skin real quick, okay?
Sorry.
Okay. I'll put it back on when I'm done. Her general appearance, it looks good. I don't see any bruising, any open skin tears or anything. Her skin color is even throughout her body. A couple of tattoos, but that's nothing to worry about. I don't see any edema. Just gonna, nope, no edema. Her toes look good. I would do capillary refill, but she has nail polish on. I'm gonna do her fingers here. Looks good. And can you go like this for me? And I don't see any nail clubbing. Looks good.
Yep.
I'm gonna put this back on. I don't smell anything, so her hygiene would be good too. And I'm just gonna inspect your axilla real quick. It looks good. Didn't feel nasty or moist or anything. Okay. Can you sit up for me one more time? Actually, I'll have you stand up this time.
Okay.
I'm going to be doing her chest, listening to her heart. Her chest looks symmetrical. Her rise and fall is symmetrical too. Okay. I'm going to listen to your heart, or to your lungs, okay? Can you breathe in? Breathe out? Good. Breathe in. Breathe out. Breathe in. Good. It was clear and bilateral. Bronchial. 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 I'm going to go under your shirt, okay? Bronchiovesicular. Bronchiovesicular. Can you pull your shirt up, please? Bronchiovesicular. Bronchiovesicular. Vesicular. Vesicular. Now I'm going to do your back, okay? Okay. Breathe in. Gonna go under your shirt. My hands are a little cold.
It's okay.
Okay. Everything was good, clear and bilateral. And I'm going to do something on your back, okay? I'm going to do something called tactile fremitus. Can you say 99?
99. 99.
Sorry.
99. 99.
Okay. Now I'm going to do excursion, okay? Can you breathe in? Okay, good. You can go ahead and sit back down.
Okay.
Can you tell me about your smoking history? Do you smoke?
No.
Have you ever smoked? Okay. Does anyone in your family smoke?
Yes.
Okay. I'm not going to get into details, but... Okay, now I'm going to listen to your heart, okay? If I can get this right. And I'm going to look at her chest again, although I did it with the respiratory, and it looks symmetrical. Okay.
Go. Go.
Oh. I'm going to listen to your aortic, and it's going to be in the second intercostal space, right to the sternal border. Pulmonary, or pulmonic, which is in your second intercostal space, left to the sternal border. Erb's point, which would be third intercostal space, left to the sternal border. Can you lift your shirt up? Okay, tricuspid, third intercostal space, left to the sternal border. And your mitral, fifth intercostal space, left to the sternal border, where you would hear the apical pulse and the PMI the best. And I'm going to listen to your, not listen to, I'm going to feel for your pulses, okay? Let's take this off. Your temporal, carotid, one at a time. You don't want to make them pass out. Okay. Okay. I'm going to listen for any carotid bruits, okay? Can't hear myself. Good. Good. Okay. I already listened to her apical pulse, and I'm going to do her brachial. Okay. Radial. And ulnar. I'm going to do her femorals. Good. Popliteal. Posterior tibialis and dorsopedius, and they're all good. Cover you back up. Okay, I'll give her a call though. Here you go. Do you need anything?
No.
Okay, raise your side rails up. And I'm going to wash my hands and document.